Hi, this is Victoria Hugert. I attend the University of Charleston at the Beckley campus in the state of West Virginia. I am in the ADN program, and this is second semester with MedSurg 2 with Professor Skylar Marsh. My topic of discussion for today is rheumatoid arthritis. We'll be talking about the definition and the etiology of rheumatoid arthritis, the pathophysiology of RA, the clinical manifestations, different diagnostics and testing to diagnose RA, the complications of RA. I will then talk about the human flourishing with treatment modalities from the NLN. And then at the end of the video, we will do a quiz just to see if you all were able to retain the information that I will be presenting today in hopes that it will be helpful and beneficial for you. And then I will lastly list my references. Hope you enjoy. Rheumatoid arthritis. What is it? It's a chronic progressive inflammatory disease. It primarily attacks joints, producing an inflammatory synovitis. It can also affect the tissues and the organs. It involves joints both bilaterally and symmetrically. It typically affects several joints at once and often starts with the upper extremities or the upper joints. It is an autoimmune disease that is precipitated by white blood cells, and that causes inflammation and thickening. Your range of motion can decrease, and that is caused by joint deformity and bone erosion. The natural course of the disease is one of exacerbations and remissions, and if diagnosed and treated early, it's easy to prevent permanent joint damage. The pathophysiology for rheumatoid arthritis is not completely understood. The process generally involves dysregulated inflammation with antigen presentation, T-cell activation, and autoantibody production, all serving as mediators in the inflammatory process. So what exactly does that mean? There is inflammation within a vital immune response that is essential for T-cell immune response. The T-cells activate and divide rapidly, along with autoantibody production, and they all try to intervene in the inflammatory process. Clinical manifestations of rheumatoid arthritis include pain at rest or with movement, morning stiffness, pleuritic pain or pain on inspiration, dry mouth, weight loss, fatigue, joint swelling or joint deformity, fever, lymph node enlargement, paresthesia or tingling in the extremities or the joint areas, recent illnesses or stressors, joint pain, lack of functioning, subcutaneous or underneath the layer of fat nodules, muscle weakness, atrophy, red sclera, and or abnormal pupil shape. Diagnostics and testing. There are some lab options. We'll start with the anti-CCP antibodies, and this test detects antibodies for the anti-CCP. The result is positive in most people who have rheumatoid arthritis, even years before manifestations develop. And the test is more sensitive for rheumatoid arthritis than rheumatoid factor antibodies, which is the next, the rheumatoid factor antibody. The higher the titer, the more severe the disease, and other autoimmune diseases also can increase the RF factor. We then have the erythrocyte sedimentation rate, known as the ESR. Elevated ESR is associated with the inflammation or infection in the body. There is different levels, mild, moderate, and severe, and other autoimmune diseases can also cause an increase in the ESR, so it's important to do other testing along with that to differentiate. We have the anti-nuclear antibody, or the ANA titer, and it is produced against one's own DNA. A positive ANA titer is associated with rheumatoid arthritis. It's normally negative, but other autoimmune diseases can also increase the ANA. So as stated before, make sure to do multiple testing. And then lastly for the labs is an elevated WBC. White blood cell count can be elevated during an exacerbation of rheumatoid arthritis, secondary to the inflammation response. And there can also be decreased red blood cells due to anemia. For diagnostic procedures, there's an arthrocentesis. It is a synovial fluid aspiration by needle, and with rheumatoid arthritis, there will be increased white blood cells and rheumatoid factor present in the fluid. Then there's also the option for an x-ray. It's used to determine the degree of the joint destruction and to monitor its progression. And they can reveal bony erosions or narrow joint spaces. Let's talk about some complications of rheumatoid arthritis. We'll start with osteoporosis. You have an increased risk of getting osteoporosis when you already have rheumatoid arthritis. Then we have rheumatoid nodules, which are firm bumps of tissue, and those typically form on joints like the elbows. Dry eyes and mouth, which is part of Sjögren's syndrome. Infections. Rheumatoid arthritis causes issues with the immune system, so a lowered immune status causes a higher risk for infection. Abnormal body composition. There is an increased ratio on the fat to muscle, even on patients who are thinner, because lots of times patients with rheumatoid arthritis have joint pain, so they don't move or exercise as often as they did before, causing their muscle tone to decrease and the fat to increase. Then we have carpal tunnel syndrome. That can happen from the inflammation around the nerves, causing compression on that nerve. There's also heart problems like atherosclerosis or hardening and buildup of plaque on the arteries, and pericarditis, inflammation of the sac around the heart. Lung disease. Rheumatoid arthritis can often cause inflammation of the lungs, which can lead to shortness of breath. And then we have, lastly, lymphoma. Next, we'll talk about human flourishing with treatment modalities. So we want to participate with the patient in care planning, and we want to identify changes of cognitive and physical limitations that can create an unsafe environment. So some examples of how we can manage that is by encouraging physical activity to maintain joint mobilization. We want to teach the patient on how to maximize their functional activity, minimize their pain, monitor their skin for any new bumps and things of that nature. We will also provide a safe environment. We will educate on physical therapy and occupational therapy referrals. We can give information for support groups. We can give referrals for assistive devices and teach them how to use them before they leave the facility. And we want to remove any unnecessary devices that may cause any falls or any type of injury. And then we also want to monitor for medication effectiveness. We want to have effective medication treatment to keep the patient from having worsening of conditions and to keep them feeling the best they can. So before running out of time, I'd like to do a quick evaluation on what we learned about rheumatoid arthritis and ask a few questions. So question number 1 is, what labs are indicated in testing for rheumatoid arthritis? And it is a select all that apply. We have A, CRP, B, lipids, C, ESR, D, ANA, and E, TSH. So we know that CRP is one. I like to work through the questions in order. And then lipids, that test your cholesterol, that is not a necessary testing. ESR, that is one. ANA, that is one. And TSH, we don't need to know about the thyroid function, so that one is out as well. So the answer is A, C, and D. Question number 2, we have which statement is clinically correct regarding rheumatoid arthritis? Option A, I don't have to take my daily prescribed medications if I'm feeling better. B, I may experience low blood sugar. C, I will have weight gain. Or D, I will experience morning stiffness. The correct answer is D. And for the last question, number 3, we have a true or false. Rheumatoid arthritis is a chronic progressive inflammatory disease that attacks the joints. The answer is true.